Rajo, 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 Katipunan, Rajo, Katipunan, Rajo, Katipunan, Rajo, 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 Katipunan, Rajo, Katipunan. The voice of W Eagle kami, di mapipigil sa pagbabalitang tumpak at tama. Buhay atin sa labas ng eskwela, ating ibibida lahat ng eskwela. Radyo, 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 Katipunan. Radyo, 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 Katipunan. Radyo, radyo, Katipunan. Radyo, Katipunan. Kawal ni Ignacio, Katipunero sugo. Todo sa kayod, tunong at tulong. Di pa W Eagle, galing hiding at tigil.
Good afternoon. It's Joey Miroy at 3 o'clock Thursdays. It's our science show and called RK Asks. What's the show about? The pandemic requires a medical response, not just a military response, but even the medical response requires a scientific response. The response of the human being to a given situation, even a crisis situation, requires rationality, and so we are hard-pressed by our being human to be rational, to ask the right and good questions with regard to the pandemic. And this is the reason why we thought of coming up with a show that will feature science experts. But also we want to be able to give a venue for our listeners who might have all sorts of questions. Students I have never heard from for a long time chat me up in SB, and they're asking me all kinds of questions. The philosophical questions I answer, but most of their questions are questions best left for scientists to answer. So we have gathered a group of scientists who have been monitoring the government's response to COVID-19, who are part of the International Fellows of Science Advice. They will explain what that is later. And two others are mathematicians who have been presenting data which should enable government to respond to the crisis. We have also gathered students from the Loyola schools, and they are here now. Bam? Bam, are you there? Say hi to our listeners.
Hi to all the listeners.
Yes. Don't forget to unmute. And Alessandra. Alessandra is there also. Say hi to our listeners, Alessandra.
Hi.
All right. Let me introduce our... Yes, there's Alessandra. Let me introduce our permanent panel. Let's start with Butch Ong, who was first to log on today. Butch, are you there?
I'm here. Good afternoon to everybody. And I'm sure mag-enjoy natin yung show today.
All right. And Ben is there. I notice he's there. Ben, are you there?
Good afternoon to all our listeners. And thank you for having me again for the program. And I think this would be a very interesting topic for today.
All right. And then from Ateneo, the mathematicians, Alex, who I always see at the cafeteria. It's so funny that I see you here now. So Alex, say hi to our listeners. Lex, are you there?
Mute. Hello. Oh, pwede na ba?
Yeah.
Magandang hapon sa ating lahat.
All right.
Yeah.
And Jomar from UP Los Baños. Jomar, thank you for joining us once again.
Yes, excited ako for this afternoon. Hello, magandang
Alright.
hapon sa lahat.
All right. So, as you have heard, our panelists are very excited for this afternoon show because this afternoon we have a special advisor to the National Task Force to COVID-19 as our guest. His name is Dr. Tony Leachon. Let us all welcome Dr. Tony Leachon to our program. Dr. Tony, welcome to our program. Please say hi to our listeners. Tony, are you there?
Can you hear me?
Yes. So, Dr. Tony, you are the special advisor to the National Task Force to COVID-19, no? Could you explain what that is really so that our listeners would be able to identify and your context?
I was just on board 2 months ago when I was summoned by the palace because of a Facebook Live that took place siguro mga 2 months ago with the death of my mentor, Dr. Raul Hara. So, nakagarner siya ng 1.5 million views and it reached the palace and the armed forces of the Philippines. And I was suggesting a template, a command center where everything is there, that you can respond with agility and sense of urgency. So on my first day, I met Secretary Galvez. Hindi ko siya kilala in the first place. And then we got also Dr. Ted Herbosa, Executive Vice President of the University of the Philippines, and Dr. Bong Bueno. Okay, so in-explain sa akin yung format. It started pala with the January when China locked down itself, January 23. And then we had this index case sometime in February 2. So the president created the interagency task force under the National Action Plan. So the whole program is what we call National Action Plan. So the National Action Plan is chaired by the Secretary of National Defense, Delfin Lorenzana, and the Vice Chair is Secretary Eduardo Año of the DILG. And then, a very simple organization, the Interagency Task Force chaired by Secretary Francisco Duque III, Department of Health, and CABSEC, Carla Nograles. And then, on the other side, the Chief Implementer, the Presidential Advisor on the Peace Process, the hero of the Marawi, that's Secretary Carlito Galvez, as the Chief Implementer. So basically, all the resolutions gagawin ng Interagency Task Force to be implemented by the Chief Implementer. Ngayon, under the Chief Implementer, we call it the National Task Force, tatlo rin yan. You have communications, you have logistics, and then you have operations. So, I'm right in Camp Aguinaldo. We have 3 layers of room here. While we're meeting at the National Task Force, meron mga USEC and ASEC on the second room, listening to the discussion, and then there's a 3rd layer for execution. So and then,
all right,
people are listening para lang makita yung org structure in their areas. Nakakonect ka sa mga regions down to the LGU. Lahat ng agencies under the Interagency Task Force, naka-zoom in lahat sila. And then we're meeting almost every day for this para maka-respond na adequately. So yun po ang structure for your...
And you're there now, right? You're there now in Camp Aguinaldo.
Yeah.
Yeah. So how would you respond to our anchor theme, which is how do we dialogue with government for an efficient medical response or a scientific response? And then I will let our scientists take over because I think it's better that the questions would come from them. So what is the way to go forward to dialogue with government for an efficient medical response?
That's very tough kasi when we started, we were given the latitude to explain to the public. Let's say the Secretary Galvez has this 15-minute virtual presser at the Camp Aguinaldo. And then kami naman, dahil mga medical persons kami and expert, may stories behind the news, particularly on the medical aspect. So we were given the opportunity to talk. No, nung karoon ng konting mga leakages sa IATF na nakita natin sa mga Viber chats and everything, nagkaroon ng memorandum from the palace that para unify the message, only Secretary Roque and Yusek Bergere will talk. And then if invited sila ng presidential spokesperson, let's say mga secretaries, that's the only time na magsasalita. So we are, of course, we have difficulty explaining, no? Particularly like pagka-launch pa lang, pagka-bigay lang ng guidelines 2 days ago, 10 interviews ang kailangan ko i-turn down. So, meron naman akong Facebook, may Twitter ako, Instagram. So, I'm trying to, help out in terms of communication and then try to soften yung impact kasi it's very difficult to explain to the public, to a 6-year-old or to the Juan de la Cruz, what is being said at the palace level. So usually ginagawa ko, tinatagalog ko ang presentation ko in the Facebook. May 9 p.m. ako every night, 9 to 10. And then I answer questions then to soften it. So, and then ang ginagawa ko rin, pag merong mga comments doon, I summarize then. And then yung mga may commonality, nire-record ko, then I send it to Secretary Galvez para yun na rin po yung contribution natin. So that's the way ang magagawa ko po ngayon kasi that's the scenario po.
Okay. So Ben, why don't you lead the discussion? I don't know if you know Ben Vallejo from you.
Sorry po. First time lang po. Pasensya na po kayo.
Alright. Ben?
Okay. Magandang hapon, Doctor. Kasi nasa tayo stage na I think there's enough information to know the trajectory of the pandemic in the country. Ang tanong na lang may mga nagtatanong kasi hindi daw flatten out yung ating curve. Plateau, nagpa-flatten out na mataas. So, and maraming lumalabas na observations at baka daw hindi maganda yung data set that's coming from the DOH in order for our modelers to make the right predictions. So, the concern now is we are 2 months into the lockdown and the need to reopen certain sectors of the economy is becoming very important. So with respect to that, ano sa tingin ninyo, do we have the right health data to make the decisions and the recommendations?
Sasagutin ko po kung mamarapatin nyo. I was invited at the palace April 20, Monday yon, mga 6 o'clock, together with the previous health secretaries po and about 14 key opinion leaders. And since ang dami ho nila nagsasalita, I was only given 10 minutes and then I spoke on 3 items. Sabi ko, Mr. President, your decision and the plan of the government is actually based on real-time and granular data. I told them that the Department of Health data is not real-time. May latency about 7 or more, 10 days. So yung nire-report natin at the 4 p.m., that's the 4 p.m. habit, will only say yung number of cases, number of recoveries, and number of deaths. Pero hindi siya real-time. So when you watch CNN, it's real-time. So pag si Governor Andrew Cuomo nag-present, makikita mo nag-change yung figures na parang NAMFREL or COMELEC. Ours hindi . So during our task force, nakinig naman ho siya. Right there and then, nag-present yung UP group kasi sinegway ko si Dr. Mahar Lagmay from the UP system at nag-present siya na may real-time yung UP pandemic team. And then after 2 days, si Secretary Anyok, kinausap ako, they made a IATF recommendation that dapat yung data should be shared. Dapat, ang sabi ko during the meeting, the communication and the data should be transparent, straightforward, real-time, open. so that the other experts in the Philippines can actually analyze the data. Kasi this is the whole problem kako ng buong Pilipinas. So everybody should have a crack to crunch the data. So nag-respond naman. Sineshare na sa LGU right now yung data. So sa DILG ngayon may data. So what we're saying po ngayon, yung sa DOH data, nag-present sila I think 2 days ago. Makita nyo, pag nagpe-present sa hapon, walang epi curve na hinahanap natin from the Johns Hopkins Hospital. And dapat, on the daily basis, dapat pinaplot po nila yun so that we know where we are right now. So, pag tinignan ko yung data by Dr. Benji ko, we're just plateauing Nagpa-plateau tayo. When we look at the Johns Hopkins Hospital, meron lang silang data. Nagpa-plateau din po tayo. And then I saw also some of the data. So hindi pa ho tayo nagpa-flatten based on my assessment. And of course, nakikita naman natin na based on the WHO criteria, a number of criterion for easing the lockdown, 6 ho yun, if I can pagpasensya nyo na po para mabigay ko sa inyo. 1, you have to reduce the virus spread and the space. Oo, yun ang una. That's the y-axis. And then ang horizontal axis, you have to, number 2, increase the healthcare system capacity. Number 3, you have to protect the healthcare workers. Number 4, you have to prepare the workplaces and the schools. Number 5, you prepare for the second wave coming from the overseas contract workers na nangyari sa Singapore and other areas. Number 6, are the communities educated, empowered, and engaged? Pagka nasagot mo yon, you're ready. But ang problema, economy hindi makahinga. So last Monday, may decision tayo on barangay level, ang granularity. Kung makikita nyo, may mga certain areas na ECQ, then modified ECQ, then general community quarantine, and then modified. So phasing siya and gradual based on the WHO criteria to open up areas na medyo low risk, and then merong corresponding quarantine for the critical areas and the moderate areas. Ganun ho yun lang yung principles na ginamit. I'll stop there po for your questions po. Pasensya na po.
Yes. So, Lex or Butch, what do you think? For Jomar, we're plateauing.
Magtatanong, Jovi, Dr. Leachon, no? Kasi ang ni-report ng DOH nasa 11,000. Pero ang report mula sa testing centers ngayon nasa 15,000. Ganun yung backlog natin. Pero yung 15,000 yun based dun sa May 12 na data. Kaya may backlog din doon sa reporting ng ating mga testing centers. So hindi din makukuha talaga yung nakalagay hindi rin yung onset ng symptoms, kundi yung confirmation ng DOH. Pwede ba nating idaan doon sa onset ng symptoms yung
Actually, tama po kayo. Late po talaga yung sa Department of Health. At inamin naman po yan ni Secretary Harry Roque na may problema po doon. Then 2 days ago po, taga-UP na po, isang academic institution like Ateneo, ang nagsabi may errors daw po dun sa data po. Kaya lang po, meron ho kaming data na fresh po dahil meron ho informatics and mathematicians din ho mga graduate ang mga military ho dito. Kami ho may graph at the level of the barangay. And then nakaga-zoom kami na parang sa pelikula. Let's say nakita nyo pula ang Maynila. When you actually examine it, hindi pala totally pula. Bigyan ko kayo na example sa screen para makita nyo po yun. No? So, kunyari, ito po. Makita nyo po yan pula. Cebu. Pero pagka sinoom in nyo po, Cebu City lang pala ang dangerous, tapos berde po lahat. So, ganun po ka-data. Ako naman nakatira ako sa Matandang Balara, yan after the UP Diliman. Kami red talaga pagka tiningnan mo, and other areas hindi. Like Holy Spirit, siya ay yellow. So, ganun ho ka-granular yon. Tapos, yung confirmed cases mo ay malalaman. So, hindi na-explain ho ng, tulad doon ito, another representation po. This is military po eh. Yan po yung Maynila, yan pula, pero ang dami pong dilaw na area at saka green. Ito po yung red, ang tawag ho dyan ay critical zone, 20 cases per 100,000 population. Ang susunod po dyan ay containment area, yung orange po, less than 20. So, yan ho ay GCQ. Yung dilaw, ang tawag nila buffer zone. Pero katabi nila yung red and orange. Ito wala ng cases to 30 days. Ito naman ho ay green. So, ito ho, ang bendition ho dito, pag pula, binaba nila sa modified enhanced quarantine. Pag orange ka, modified GCQ. Atong dalawang ito ay GCQ. Never na ho tayo magbabalik po sa normal. Ang new normal natin po, naka-quarantine pa rin tayo until po dumating ho yung bakuna in 2022. So our new normal will basically be na social distancing, nakamaso tayo and all. We will not expect to be the way we were before. Ang lowest natin naka-social distancing tayo. And then ang pagpasok po based dito, depende po sa kunyari ngayon, ibigyan ko example kasi tatlo po ang kulay pula, ang orange and pula eh. That is NCR, Laguna and Cebu. Ito po yung inyong mandato, limited movement within zone for essential work, operation 50%, limited transport services, suspension of classes. Then every 2 weeks, i-assess po yan. Pag kulay dilaw ka, GCQ, ang operation ng workforce tataas 75%, transport services to support government private sector, and then maaaring magbukas so ang klase niyan dahan-dahan po. Ang modified ECQ, yung berde, pinakamababa, permissive socio-economic activities. Pero magme-maintain kayo ng minimum public health standards po. So, yan ho. But, kunyari, tumaas ang cases nyo, ayon ho dito sa aming granular and timely data, the LGU should lock it down. Kaagad, threshold ho kami. Pagka naka-20 kayo, tayo yun sa gusto, isasara namin po kayo. Ganun po ang aming naging decision po.
Dok, baka pwedeng i-share din sa public yung data mula sa dyan sa inyo. Para bang Operation Quick Count, tapos meron tayong official, pero DOH official yun, pero meron tayong parang Operation Quick Count. Importante yan eh.
Opo, alam nyo sir, yan ang hinahangad ko eh. Kaya lang, alam nyo pag kayo advisor and then hindi kayo decision maker, kahirap po sir. And ako naman ho, sineshare ko in whatever way sa publiko. Kaya lang ho, when you're not the decision maker, you can only do so much. Kaya tini-Twitter ko po, pine-Facebook ko po, pine-share ko po. Yun. Kasi ang hirap po nito eh. Ang sabi ko nga sa kanila, ang pagro-roll out ng communication to, para naglalaga ka ng bakang matigas. Bago mo i-roll out yung final decision, dapat last week pa, i-roll out the guidelines, let's say, zoning and localizing, explain that. Explain what is phasing and gradual. Explain what is modified. So that on that day one, explain mo na yung geographical sites and then try to answer the question. So we call that, as a cardiologist, I prime my patient. Ibig sabihin, kung may mamamatay na pasyente may lung cancer, 7 days pa lang sinasabi ko na ganitong sitwasyon para makapaghanda yung pasyente. But I can only suggest, sir, on the communications. But they're listening, dahan-dahan po. And hopefully we can have an open and candid communication so later on. But for you guys na nasa Ateneo po, which is anak ko dyan ho nag-high school, I have many friends from Ateneo. The social media po, ang lakas po niyan eh. That can actually shape up yung ating communication process po. In a nice way po. But I think powerful po kasi ang social media ngayon. Pag nag-trending ho kagad, lalo na sa data information, very, very important po yun. So parang base up po sana ang approach. Ground swelling, ibig sabihin manggaling po doon. Pag nag-trending, usually ang nasa-shape up yung decision makers, uma-action sila ho kagad po. Ganun ho ang nakikita ko po rather than an apex to base approach. Napakahirap po nun, sir. Kasi sometimes hindi ma-capture ho ng presidential spokesperson yung lahat ho ng questions, lalo na on the medical side. My suggestion is multiple communicators ni Speakers Bureau ka, and then assign them so that they can respond with agility to the questions specifically on other items outside of the press statement.
Right. What about Butch Ong? Butch?
Yeah. Good afternoon, Doc Tony. Some of my friends who are from the LGU, specifically actually Visayas, have been asking me.
Butch,
yes.
Can you?
Yes.
Can you?
Yeah. Better,
okay.
yeah. I have some friends from the LGU, especially in the Visayas area, who have been asking me if there are protocols being planned now on the exodus of people from Manila, Cebu, going towards their area. Like for example, Leyte and Samar. Meron na ba tayong mga pinaplano na mga on what kailangan ba ng mandatory testing when they leave and when they enter?
I can answer that. I can answer that. Can I? Okay.
Go ahead.
Oo. Sa ganito yan siguro last week, alam niyo po ba meron tayong 23,000 OFW na sa mga hotels at saka na sa mga boats na malalaki ng AFP. Ngayon, ang protocol kasi, tapos meron hong tinatawag na LSI, Locally Stranded Individuals, na Pilipino sila, naipit sila. Let's say I'm from Cebu, pero ang bahay ko talaga Maynila. During the lockdown, nandyan sila. Meron ho sa Baguio, pero Manilang bahay na. Ang anak ko, my son is a provincial board member ng Mindoro, pero during the lockdown, nandito siya sa Maynila. So, ang protocol pala dyan, door to door. You have to have two requirements lalo na kung galing ka from a red portion tapos going to a clean area. There are two requirements po. You need po a medical certificate from a doctor that you're COVID-free. So, kailangan magpa-testing kayo ng RT-PCR or rapid testing. Tapos sasabihin COVID-free kayo. Kunyari ako, pumunta ako ng Davao. Pumunta po ako ng Caraga last Saturday. We met sa, nagpa-testing po kami. Malacanang nung April 20, nakapasok lang ako after rapid testing. Negative ako sa IgM, IgG. Pinapasok ka, pero naka-shield ka and then nakaganito ka. And then the LGU will issue a transfer authority na kung magta-traverse ka ng maraming LGU, igagalang po yung authority na yun. Kunyari, Cebu ka galing, luluwas ka ng Maynila, ganun po yung mangyayari door to door. Ganun din ho ang magiging ruling para ho hindi kayo ho magkalat po. Siyempre, may mga questions ng Maynila. If you remember, si Mayor Olivares, may interconnectivity daw. Kunyari, nagtatrabaho ako sa Makati, galing akong Bulacan, pagtatraverse. Ganun po ang idea. Dapat pagpasok nyo po, meron. Iba naman, tapos magre-request kayo ng ganitong ID sa DICT na meron hong ganito. Yung may code ho, may code. Ako ho, kaya ako nakakapasok dahil meron ho ako nito. Inire-request ho yan online sa DICT to get, kunyari essential worker ako, doktor ako. Siyempre, Quezon City, red area yon. Punta ka ng Maynila, pero ang dami mo itatraverse. Pag na-issue ka ng ganyan, meron requirement kasi pag dinownload nyo sa DICT, tapos isasubmit nyo online. I-email po sa inyo, sir, at ite-text po sa inyo pag approve na po. So you can travel po yun. Pero meron po siyang deadline. Let's say dati May 15, nakuha ko na po yung aking renewal hanggang June 30. So, nakasigun ho yun sa doon ho sa timing din. Diba sabi ko sa inyo, gradual and pacing. Kasi baka mamaya nagkasakit kayo. Kaya in other companies, rapid testing in other areas. Kasi yun nagiging certificate of immunity. Remember Dr. Anthony Fauci saying your antibodies eventually, pag negative ka or kung positive ka sa IgG, that can be your immunity passport or certificate of immunity. Kung ako tatanungin nyo, yung mga anak ko ho, lahat sila pina-rapid antibody. Kasi mahirap din po yung sa ilong at saka dito, na-try ko ho yun. At ang results ho niya, 1 week pa. Matagal po yun. Pwede naman ho yung isa na gamitin para lang ho kayo may diagnostic tool going to another area. We know that the RT-PCR is the gold standard, kaya lang hindi ho siya available in far-flung areas at hindi siya accessible. That's why we innovate dito sa camp and advocate to use the rapid testing just like what the President is doing at the Palace. So is it clear po ba that I need to explain more?
Oh, okay na, Doc. Just another question that came up. When the traveler from Manila or Cebu, for example, goes into Leyte, from Cebu to Leyte, medyo mas malapit yun, no? Will the LGU in Leyte be required to quarantine those who come in a particular barangay, for example, even if their antibody test is negative?
Okay. Alam niyo po, nag-meeting ho kami ng mga ulap. Yun ang ulap po is the United League Association of the Philippines. Ito po ay grupo ng mga gobernador at mga mayors sa buong Pilipinas. Ang president po niyan ay si Quirino Governor Dax Cua, Dakila. Nandun din ho ang presidente naman ng gobernador, si former Justice of the Supreme Court, Presbyterio Velasco. Andun ho din sina Jolo Revilla, mga ganun. Dami po sa Zoom. Andun ho ako with Secretary Galvez, saka si marami po nandun eh. Pero ito po yung sasabihin, ang sabi lang nila, igagalang daw ni Secretary Galvez kung ano yung local guidelines. Kasi, kunyari, ikaw ay ang gusto nila RT-PCR kaya nagtatagal, ayaw nila ng rapid test. Pero yung anak ko, nagawa siya ng resolution, wala kami RT-PCR, kawawa naman yung mga tao. So, rapid antibody test is being recommended, not mandated, and they flexible ka sa karga. Pero, yung local government unit, nagtanong ho yan si Governor Corvera ng Caraga, kung nire-require nila pa mag-quarantine after pagdating, sabi ni Secretary Galvez, we will defer that to the local government unit. Kung gusto nyo pang i-quarantine, let's say yung mga overseas contract worker, nag-quarantine na ho dito ng 14 days, ite-testing, ililipad sila let's say sa Mindanao. Kung yun ay mandato or requirement ng local government unit to make the community COVID-free, it's their decision kasi ayaw naman natin magkaroon ho ng transmission doon. So, i-explain lang hong mabuti yan doon ho sa mga dadating pong mga return overseas contract workers natin or returning Filipinos or locally stranded individuals po. So yun po ang sagot nila. Kasi may local government code which is autonomous po. Ibig sabihin the mayor or the provincial governor has the right to mandate to save ho yung kanilang locality. And quarantine ang required nila is 14 days and they need an RT-PCR. No less, mahigpit sila going into their provinces or local government unit.
Okay.
All right.
And
go more. Meron pa.
Can I have one more question? Kung papayagan ako. Doc Tony, siguro narinig mo na there are a lot of doctors now who want to open their clinics and mga high-risk clinics so like ENT, Opta, dermatology. Sa ngayon, I know the dermatology aesthetic is not yet allowed, no? But when do you think, or what are the criteria sa ating data you think will be good enough for these high-risk clinics to open?
Very good question. Marami nagle-lecture yan sa webinar. But I'll tell you, ako hindi ako ready. I have 3 kids, no? My wife is a physician, a pediatrician and working at a multinational company. Then I have a 30-year-old bukal, provincial board member. Ang asawa niya is sa San Miguel nagtatrabaho. Then I have 2 other kids pa, si Vanna, si Mike and si Vanna. Doktor ho yun. Then si Jolo, yung atenista kong anak sa high school. And then mga doktor po sila. Alam mo, hindi emotionally, ang pagpe-prepare pala emotionally. Are you ready to face it? Number 2, are you physically ready? Meron ka ba ng mga gadgets? Are your secretaries ready? Is your environment ready? Malinis na ba yung environment mo? Na-disinfect na ba? Are the elevator setup already? Are the queuing mechanism already? Kasi hindi pwede magtambak-tambak in the waiting area. So, I feel as a person right here at the office, I don't think we're ready. And ako June 1 pa ako papasok kahit sinabi naman nila doctors meron na. Magte-telemedicine muna po ako. I will prepare muna po my clinic. I will try to ensure the safety of my secretaries and ensure the safety of my patients as well. Kasi pag umuwi ako sa bahay at madala ko infection, sila po lahat. Kaya ako pagkagaling ko dito, naliligo muna ako sa garahe, naka-plastic na lahat. Tapos papasok ako bago lahat po. At nakamask po ako going into my room. Pagkakain po ako, malayo po ako mga 6 meters po. Kasi that's the sacrifice we have to do. So the long and short of it, I don't think we were ready kasi we have not encountered an epidemic in our lifetime. So, nung una akong pumasok dito, takot ako eh. So, kailangan mag-break in ka muna and to see the environment eh. And then overcautious ka, obsessive-compulsive ka on cleanliness. Ibig sabihin, meron akong mga dala pang mga sampu just in case may mabutas. I have 2 alcohol na malalaki. I wash my hands every hour. Something like that. I don't think we're ready, to be honest with you. Ang tingin ko, dapat facing din, mag-telemedicine. And then, pagka ready na yung environment, saka po kayo mag-facing. Dati, I see 30 patients a day as a cardiologist. Gagawin ko 10 lang muna so that malaman ko yung effect. Kasi ang hirap po, magkasakit naman ako, quarantine ka kagad, pati mga pamilya mo. So it's difficult. So I don't think we have a sure answer kasi even in the States, nobody can say na safe na bumalik ng clinic right away. Yun,
Okay.
like anak ko ngayon pumunta ng dentist.
I think must be proactive and make sure that they understand the risk and so that they can mitigate the risk.
Right,
Jomar.
exactly, sir.
Jomar,
Perfect,
what's
sir.
your
Perfect.
question?
Yes,
Omar.
magandang hapon Sir Tony, Doc Tony. Isa lang po yung question ko. Balikan po natin yung testing, no? So alam natin na gusto din talaga ng government na maitaas ang capacity ng testing natin. But alam din natin pag tiningnan yung mga tracker natin ngayon, kahit i-increase yung capacity, hindi rin naaabot pa. Ano po kaya yung mga problems ngayon ba't hindi pa naabot ng mga testing centers natin yung capacity nila? At ano pa ba yung mga balak ng government para mas maiangat pa to yung testing numbers natin per day?
Okay, very good question, Iho. Alam mo, nung una ako pumasok dito, 3 days, I was asked by Secretary Galvez and all the generals and the IATF, ano ang nangyari? So since wala nakakita ng epidemic in our lifetime, di ba, nakita mo yung Senate hearing na about contact tracings and the lack of test kits 2,000 na. So dahil ako'y doktor, I went to the literature. So I went to the Ebola outbreak, I went to the SARS, H1N1. So I used 2 reference models. The Ebola outbreak, I was past president of the Philippine College of Physicians, a group of 10,000 doctors, noon na may Ebola outbreak. Ngayon, siguro wala nakapagbasa na may Congress hearing pala sa US yan. And these are the 5 recommendations. So we learn from the past. Kaya pag nag-history ako ng patient, importante yon. Okay, what are the recommendations? 1, dapat may social distancing kaagad at the time. Dapat meron na kagad noon. Talaga ila-lockdown mo. Ebola kasi 1 in every 2 namamatay. Number 2, dapat may testings ka. Ang description nga doon sa Congress you're just like looking for a needle in the haystack when your eyes are blind, when your eyes are closed. Imagine mo, naghahanap ka doon ng karayom sa dayami na nakapikit pa. Since daw ang object na to invincible, hindi katulad sa gera, how can you light it up kung hindi mo nakikita? So you need to do the testings, the isolation, and the quarantine kung magla-light up siya. So napaka-importante yun. So number 3, you need isolation and quarantine areas once na testing mo sila so that you isolate the sick from the healthy. Number 4, you have to repurpose the military. Kasi lockdown and border control, hindi mo magagawa yan without the military, lalo na sa Ebola. Ang ginawa lang sa Ebola, they prevent the rural kasi ng isang Ebola na kumalat to the urban areas. Tayo urban right now, tapos pupunta sa rural areas. And then ang huli, you have to enlist the best people na makakatulong sa'yo because the government has no monopoly of talents. You have to enlist the researchers, the epidemiologists, the economists, and share the data because hindi mo magagawa yung mag-isa. So I looked at the South Korean model. There are many countries na hindi nakapag-lock. Ang China kasi sila nagpa-umpisa, pero ngayon okay na sila. But I'd like to point out doon sa questions mo, bagay na bagay ito sa'yo. Ang South Korea kasi at Vietnam, hindi na-lockdown. Nagbasa sila kaagad ng history kasi nagkaroon sila ang Hong Kong, nagkaroon sila ng SARS, H1N1. Ang template nila, simple lang. Wala silang lockdown. From the day 1, kinuha nila yung genome, nag-test kits kaagad sila. Tapos nag-testing sila. Ayaw nilang palapitin yung pasyente sa hospital kasi you can infect the doctor. So nag-drive-through sila. Drive, malayo, detached mobile testing centers. And using the power of digital technology, within the day, makukuha mo kaagad yun. And then pag nag-positive ka, ite-text ka at may rule doon na pag hindi ka sumunod, may fine ka or ikukulong ka. Ganun ka-discipline yun and through digital technology. Tapos isolate ka. Tapos may tracker din sila kung ikay lumalampas ng border. And then meron silang commitment of transparency na ilalathala na ikaw ay may COVID para maiwasan ka. And then nagkaroon sila ng problema 4 days ago. Merong isang super spreader na sa sobrang katuwaan, nagpunta ng 5 bar ng hawa. Nag-lockdown kaagad sila, 30 days. Yun ang sinasabi natin ni Secretary Anyo kanina o kahapon. Kaya tayo nag-modify, meron tayong mistiso, hindi kaagad galing from a lockdown. So meron tayong dry run. Ang Japan, biglang kumalat sa Hokkaido. Di ba? Tapos yung itong napakagrabe, itong Singapore. Nung nag-lockdown sila, dumating ang migrant workers, highest ngayon sila in Asia, 25,000. So, ang learnings dito, Iho, dapat nun pa tayo nagplano. Kahit anong gawin natin, hindi natin magagawa ang mega swab na yan, 4 ang ginagawa. Kasi it takes time. It takes na mag-build. Imagine you're doing testing centers in the midst of crisis. Hindi. Dapat yan nung una pa. So the lockdown is essentially an expensive strategy. Expensive strategy. It is actually sa 2 months time dapat nakapag-buy time na bilisan ng local government unit ang pagtatayo ng testing center. Pero hindi nag-seek in with the local government unit na they should have taken that initiative to create the isolation quarantine areas and do the rapid testings right away kung wala pang RT-PCR. You know ang solution dyan contact tracings And that may reference modeling naman. Hindi ko nga alam bakit hindi po nag-research yung ibang mga LGU. Nasa literature naman po yan. Noong na-realize nila, it's too late. It's too late already. Overwhelmed ng RITM, kaya hindi na ma-report ng tama po yung mga data sa Department of Health. Kaya makikita nyo sa Department of Health, wala kang epidemiologic curve kasi dapat real-time siya. Ang nire-report lang 3 cases, recovery, and deaths. Pero wala kang curve because it's not real-time. Ganun po, with openness and candor, yun po ang explanation. To tell you, 28 pa lang ho yung laboratories natin, ang target natin 100. Mahirap pong gumawa ngayon sa panahon ngayon. Kaya inappoint to si Secretary Vince Dizon as the czar. Pinagtutulungan na ho ng Ayala, Joey Concepcion, ng business sector, and they using the rapid testing muna kung wala kang RT-PCR in your business community or in your LGU. Yan ho nangyayari po sa ngayon. And you're right, I agree with you. Kaya dapat ngayon yung mga local government unit, ibuhos nyo na lang, makipag-partner kayo sa mga business. Kasi alam naman natin mahirap magtayo po ng mga isolate quarantine areas kung wala kang pera. Lalo na ngayon, ubos na ang pera ng government sa SAP. Eh ngayon, hindi naman nagpa-flourish ang business kung hindi kayo tutulong magpagawa ho ng mga isolation and quarantine areas. Kasi kung gumanda ang inyong community na isolate nyo yan, bubukas uli ang business. So ang rate limiting step, mga kaibigan, is basically the mass testings and the infrastructure. Without it, we cannot survive the next 2 years. So prior to the coming of the vaccine, or we will die. Ganun po mangyayari. So we have to prepare po.
All right. Let's hear from our students. We have 2 students, Bam and Alessandra.
Hi, can I ask a question? Since there is going to be a modified ECQ, which means about 50% of the workforce is going back to work, how about for those who lack transportation to go to work? If public transport is not allowed yet or limited.
Okay. I hear you, Iha. Alessandra, no? Okay. Ang nakalagay dito, sa area classification, I'm sure nakita niyo na to. Explain ko sa iyo, Iha, ha? Pag modified ECQ, that's an orange and a red on the map. Sa granular data, so you have to enter siguro the NCOB yung sa UP or the DILG. Nakalagay dito, first bullet point, limited movement within the zone, and then essential services and work. Operation, manufacturing and processing plants up to a maximum of 50% of the workforce. Like my wife works at Unilever. Work from home siya, so siya ay office-based. Pero ang required, Iha, manufacturing processing kasi kailangan on the ground, lalo na for food security. Pag ang unang-una ngayon, dalawa, Iha, ang required, sabi ni Secretary Dominguez. Pagkain. And then, yung construction, build. Kasi mag-generate siya ng business, lalo na doon sa atin. Kasi pagka may nagtatrabaho, yung mga ating mga mahihirap na kababayan, makakalabas. And since construction siya, may social distancing siya. Pero mangangailangan ka ng transport. Kaya ito sabi ni Secretary Carl Chua, isang magaling na NEDA secretary. Pagka nag-allow ka ng maraming tao, you will need public transport. Kaya bubuksan naman, Iha, ang transport pero limited lang according to the number of the population. Lalo na for essential goods and services. Tapos wala mo ng klase kasi makakadagdag ito. Kaya ang pasok ng mga bata ay sa DepEd, I think August last week. Sa CHED naman September. Kasi alam mo naman 30 million ang estudyante. So ang papasukin mo na, Iha, yung mga essential workers. And then with limited transport. And perhaps baka magkaroon sila ng mga buses din or shuttles. My wife po, isa-shuttle po yung mga yung mga workers, so meron silang drop-off points. Hatid sila bahay to the planta. Yun ang mangyayari kasi in areas na walang MRT, kailangan nyo po silang i-shuttle or ibabas with social distancing po. I hope, Alessandra, I answered your question.
Right, and Bam.
Okay, so, hi, Doc.
Hi.
I'm asking for a friend. They have a business, and she's asking if.
Can you make your voice louder? Sorry.
Sorry. So my friend is asking because they have a business. Will it be the discretion of the private companies if magpapapasok sila ng tao or hindi during GCQ?
Very good question. Alam mo, sa company ng my wife kasi, kaya swerte ko, my ex-girlfriend, just on the other side, Vice President siya ng Philippine College of Occupational Medicine. Silang gumagawa ng guidelines. So easily I can ask them. Alam mo, doon sa kumpanya nila, meron silang level kung sinong papasok based on the severity of the calamity or epidemic. Alam nila kung sino ang papasok. May Tier 1, Tier 2, Tier 3, Tier 4. Alam nila yung maninatili sa bahay. Alam nila yung papasok. So meron pala silang ganon na hindi kunyari bigla nag-declare ngayon ng calamity. Alam nila yung business continuity plan nila, alin ang mahalaga. So meron na sila. I hope the other companies should be like that, na alam nila ang, like siya, medical director siya, sa bahay siya, hindi naman siya kailangan nandun kasi radar screen ang tinitingnan niya. Pero sino pwedeng pumasok? Aba, di security, di food, yung mga ikabubuhay natin. Kasi pag hindi natin pinapasok yun, naka-skeletal force yun, kailangan. And then susunduin talaga sila. So ang tanong mo, Iho, alam mo ang business community, gusto talagang pumasok. Kasi pagka, lalo na yung mga medium and small, pagka nagtagal pa yan, malulugi. Ang mga multinational, mahaba ang PC niyan eh. Pwedeng matagal walang pasok. Ang inaalala natin, yung mga kababayan natin na mga local businessman na pag tumagal, wala. But I think may plano na, Iho, na meron silang groupings of the more important employees na papasok. So I hope na nasagot ko yon. Sila din na nagde-decide kung safe para sa mga empleyado na magpapasok o hindi.
Sige po, salamat po. Meron pa pong isang tanong. Paano po kung kunyari like sa pagbukas ng klase, like there, for example, in the Ateneo grade school and in the Ateneo high school, the average class size would be 45. In the college, it would be 30. So paano po yung suggested na social distancing doon, ganoon?
Very good question. Kasi kasama ko si Dr. Ted Erbosa, Executive Vice President ng University of the Philippines. Number 2 po ni Attorney Danny Concepcion, ang UP President. Ang problema pala sa UP, mag-o-online sana sila, kaya lang 30% walang computers. Kaya yun ating mga kababayan may problema doon. So, sa Ateneo, I'm sure may mga computers kaya pwede kayong mag-online. Kaya ang sabi nga niya, ang magiging standard rule sa next enrollment, dapat minimum requirement kung gusto mo, libre na nga ang tuition ng state university colleges, at least man lang meron kang iPad or laptop as a minimum requirement. At alam mo, Iho, galing ako Mindoro in 1977, batch ni Pinoy yun. Ang dami kong kaklaseng Ateneo, sa UST kami pumasok. Probinsyano ako, pero pag sinabi, ito yung minimum requirement, ipangungutang ng nanay at tatay ko yung kailangan. May libro ka ba? Kasi minimum requirement siya eh. Ngayon, in this era of information technology at hindi tayo nagkikita, the laptop and all these gadgets are minimum requirement eh. Kasi dito tayo magkaklase eh. Like my son right now, hindi natapos yung kanilang internship. Ang klase nila is basically online. Kaya for the first time in history, according to the Professional Regulation Commission, tuloy ang board exam sa June at September using online. Kasi hindi naman pwede 3,000, dikit-dikit kayo. Diba? So mauuso yan, hybrid, Iho, ang tingin ko. May mag-o-online, mag-social distancing yung iba. Parang sa Congress, nakita mo na, merong kalahati nun, may social distancing, ang iba naka-online. My brother is a congressman from Mindoro. Hindi siya makapasok pero may hearing. Naka-Zoom sila. Alam mo, necessity is the mother of innovation, sabi nila, or invention. So, ang sagot ko, matatalino yung mga Ateneo. They will try all of the things. Pero tingin ko mag-o-online kayo. Yun ang tingin ko.
Follow up lang po. Like,
sige,
paano
sige.
po kung kunyari, sabihin natin sa public school po, paano po yung magiging sistema nila kung sakaling, for example, yung mga areas na walang signal, yung mga bata na kailangan pang sumuong sa ilog para makatawid, ganon. May plano po ba ang gobyerno para matugunan yung ganong mga klase ng sitwasyon?
May sinuggest ako, dapat isulong sa Kongreso at sa Senado right away na magkaroon ng free internet and wifi sa kaliititan. Kasi kung paano mo, universal yan eh. Kaya mayaman ka mahirap, kailangan mo na internet eh. So kung yan ang limitation ng University of the Philippines, dapat i-provide yung internet para bibilin mo na lang gadget. Ang ibig ko sabihin, Iho, dapat ang mga DICT together with Smart and Globe, dapat yan ang asikasuhin nila. Kasi in the next 2 years, ito magiging buhay natin eh. Zoom and everything. Paano naman kung mahirap ka? Di wala. So, ang uunahin yan, ipapafile ko sa brother ko yan and other senators na yan ang dapat gawin. You're right. Kaya, na-testing ko na yan eh, dito sa UP and then sa mga taga-private schools. Yan ang magiging problema mo. May solution naman. Our role is to solve problems eh. And we can only respond to the questions. And your question is good. Ngayon nga, pagkatapos ito, i-reiterate ko Secretary Galvez na sa next IATF na imandato yan and then let the Senate and Congress file a bill and with the DICT. Kausap ko si Yusek Rio, magaling ho yun, na i-inform ko sila about your predicament and your questions.
Pero
Alright,
ano po yung meron po bang at the moment na ginagawa yung government na hakbang para sila po yung mag-adjust, hindi po yung tao? Kasi dapat po tao po dapat government po yung nag-a-adjust sa pangangailangan ng tao eh, hindi po tao yung nag-a-adjust sa pangangailangan
ngayon
ng
kasi ang nagdi-dictate virus eh. The virus dictates our destiny. Kahit anong gusto natin gawin, hindi natin magawa dahil hindi tayo nagkikita-kita. Ibig sabihin, even our sense of urgency, hindi natin magawa eh. You're right, ang may kapangyarihan ngayon, gobyerno eh. Pero ang variables natin, ang dami. We don't see each other. We don't have the Congress, Senate. We don't have everything eh. So what we will do right now is try to innovate on what we can do. And yan ang una kong naisip right now.
All right, thanks, Doc. We're almost out of time, but let me ask Ben, do you have a follow-up question? Maybe we can extend for 5 more minutes.
No, it's a comment. Our science advice system needs improvement. One of the first things, for example, with regards to mass testing, I was asked by the International Network for Government Science Advice, which I am a fellow, to immediately send observations on the capacity of for molecular diagnostics at the start of the pandemic. One of our we don't have enough capacity. Our molecular diagnostics is only for research. Kaya nagkakaproblema tayo. Okay? But the thing is, the other Asian countries like Vietnam, okay, which is a little bit similar to our developmental stage, they invested in that in the regional Vietnamese universities. Kaya nung nag-pandemic, they're able to test. Okay? Tayo wala eh. Everything has to go to NCR, most specifically to UP Diliman for testing and UP Manila. I think that's one of the things that we have to look into is to develop the molecular diagnostics capacity. Kaya tayo nahihirapan. It takes 1 week to get results back, while in Vietnam they can get it in 1 or 2 days. Even now it's within a day na hanggang according to
Ben, so are you suggesting to Dr. Leachon that maybe he can involve you and some others?
So, I think that we have to streamline yung ating science advice system in which you have a group of scientists. They would come up with a single recommendation and give it directly to the IATF. Parang the scientists will be integral to the decision-making process. It's not just the policymakers deciding. It's integral in a supportive role. Wala tayong ganun eh. But in the UK, there is something like that as a science advisory group for emergencies. I recommended that to the INSA for as a proposal. We need something like that.
I actually support si Ben. Maganda yung suggestion niya. Reclusive kasi minsan ng mga agencies eh. Yan ang nangyayari. So they want to stonewall. Sorry for speaking kahit nandito. Stonewalling is a problem minsan eh. But I have a suggestion. Yeah, you need to have the pandemic law and invest on healthcare. Do you know that in Taiwan there are more hospitals and clinics than convenience stores? Now, my dream is to have a Philippine General Hospital in every region. na meron kang human resources, may processes ka, may infrastructure, na you don't have to go to Manila. Like say ako galing ako Oriental Mindoro, I studied from UST then UP Cardiology. Then babalik sa ako ng Mindoro. Wala pala dong hospital and 2D echo. Balik ako ng Maynila. So nag-urban migration. So I'll propose a pandemic law that will invest on healthcare so that the economists and the scientists can be in Region 1, Region 2, hanggang Region 14, na you have a replica of the university system na may Ateneo din. At every hospital should link up to the medical university. So we need a university hospital parang sa Boston. Harvard Medical School, ang kanilang hospital, Massachusetts General Hospital. And all of the hospitals in Boston, binibigyan ng academic support. So dapat ganun ang mangyari. So that pagka may pandemic, lahat ng mga experts in that locality, meron silang sistema, hindi ka lang nandun sa Maynila. So nung Maynila nagkaroon ng epicenter, patay lahat. So dapat i-scatter na natin ngayon yon. We have to do that. Even Ateneo should have like that also. Kunyari, meron kang Ateneo and Medical City. Dapat yung mga Ateneo in other areas, meron din silang hospital. So you distribute that. Ang UP dapat ganun. UST, I'm from UST. They're starting to buy hospitals and I think meron sa Mindanao, sa Visayas, and then I think sa San Pedro magtatayo sila kasi yan ang naramdaman eh. So idea is to distribute from the center to the peripheral, and then only a law can actually do that involving kasi ideas kasi pagka evanescent yan eh. Pagkatapos ng pandemic wala kasi siya eh. But if it is a law, we can craft it together kung gugustuhin nyo. We can meet again pagka in stable time and then write that particular law with all the trimmings. Ateneo is an institution. Then we can sponsor that bill together that in every pandemic may response team na. Kasi tayo we are assaulted by typhoons, 20 typhoons a year. Lagi tayong parang sitting ducks. Pagka umulan, wala tayong pasok. Ganun na lang ba ang buhay natin? Hindi dapat ganun. We are assaulted by volcanic eruptions every now and then. So anong ginagawa natin? We duck lang and then we suffer and then magti-Twitter ka, magpe-Facebook ka. Wala yun. We need to prepare for the future. Yun ang dapat natin. Invest on health, the law, and provide resources.
Dr. Lee, just to how feasible is what Lex is suggesting about a non-federal type of, as you were saying, real-time data?
Pwede yun.
Can we still do that?
Alam mo ba sa Red Cross kayang gawin eh. Kung nagka-non-federal nga kayang gawin, ba't hindi kaya? Alam mo kailangan lang yan push. If the decision makers kasi naiintindihan nila yan, bakit hindi pwede? Nakapag-election nga in 2 days, alam na natin ang winner. Imposible naman din natin malaman to, hindi naman buong bansa to. Ang ibig ko sabihin, these are reporting system lang eh. So there must
so maybe we can do that, no? And encourage more of business to set up mass testing centers. But how, because it is,
ang suggestion ko is the business center.
Very few molecular biology.
Ang suggestion ko, the business center should take the lead in the data gathering to help kasi they have the muscle, the money, and the resources. Kung asa tayo sa gobyerno, bureaucratic po yan. So ang ibig sabihin, pagka ni-request mo, baka sa isang buwan pa, wala na ho yan. Alam nyo naman, pag corporate po, they can drive everything ho eh. Kasi siyempre, they have the resources, they have the money, they have the infrastructure, they have the thinking process, they have the sense of urgency. I think ang dapat focus ng business community ngayon is to help out in the information gathering. Okay naman nagde-donate sila sa mga mega swabs na yan, sa mga testing center. Pero ang the heart and soul of everything is about data collection. Our decision is based on real-time and granular data. Kung mali ho yun, di tayo makakapag-decide. So we must invest and perhaps push our leaders. And even Ateneo and UP, dapat yan ang gawin natin ho ngayon. Sa akin hong palagay, di ako nakakatulog every time makita ko yung data na hindi siya updated
Right. So we have reached the end of our show. Guys, it's kulang ang oras natin. Do you still have a lot of questions?
Meron pa sana eh. Anong dapat gagawin ng mga netizens para makita namin yung data dyan sa kampo?
Ang dapat nyo pong gawin, una-una, magpa-trending ho kayo that you need the data.
Okay.
Pag nag-trending ho yan, mapepersa ho ang government. Nakita nyo nung si Arnold Clavio biglang may sinabi, may namatay sa East Avenue. Wala pang 2 oras, may sagot ang Department of Health eh. Tama po ba?
Okay, tama.
Oo. Ganun ho ang proseso sa atin eh. Pagka nag-trending, yun na yun. Why don't you trend the real-time granular data now? Ganun ho. And then, pag nag-trending yan, I'm sure appoint yung DICT para i-mandate ka agad dyan. Diba? Ang bilis, DICT will be given the power. Di lahat tayo ngayon may data real-time and granular. So, may DICT tayo eh.
Yun ang battle cry natin, real-time granular data.
Real-time and granular data. Now.
Okay, now. Okay.
All right. So why don't we all say our parting words for this week? You can start, Lex.
Okay, so ano lang, dapat nga real-time and granular data ang mangyayari now. So yun ang gagawin natin ngayon, no? Hikayatin natin ang mga netizen na kailangan sasabihan sa ating gobyerno na ipakita na sa atin yung real-time and granular data. Maraming salamat.
Thanks, Lex. See you next week. Butch?
Yeah, siguro yung malaking take ko dito sa usapan natin is being ready, no? My friends who are doctors, my classmates, dami nagtatanong sa akin kung kailan nga ba. Tama si Doc Tony eh. We should be ready, we should feel ready, and we should be ready. I'd just like to commend Doc Tony for all his work for the IATF. And if I may, Doc Tony, may I submit to you some of the recommendations from the mayors that were given to me?
My cell phone is 0917 530. You get my number?
Ano na lang, Doc Tony, I'll ask Jovi to email you.
My email, anthony.liachon@gmail.com.
Okay.
Anthony.liachon@gmail.com. And then, you can follow me on Twitter, Facebook. I have 3 Facebook accounts, isang public page. You can find me. But email, Doc. Okay. You get my number from the sponsor here.
Yes, Doc.
And then, let's create a Viber for the Ateneo group. Para sa ganon, I'll give you some data na hindi nyo pa nakikita. Para sa ganon, you can use that. Yung na-announce na ng Palas, pero walang stories and slides behind the headlines. Yun ang kailangan nyo eh. Diba?
Right. Sige. Then, Jomar.
Yes po. Salamat po, Doc Tony. At mahabang laban ito. Tulong-tulong tayo mga siyentipiko at mga medical doctors sa laban na to.
Yes. Kailangan natin ang tulong ninyo. We need the best and the brightest minds for our country, or else mabubulok po tayo sa bahay natin and the future generation of Filipinos magsasuffer. Kaya ako, kahit ako at risk na baka magkasakit ako, kahit mahirap po, alas-tres ako natutulog to research. Kasi isa lang ako sa 2 o 3 advisor. Kaya lang iniisip ko, paano na ang future natin kung hindi ako magsasacrifice for you. But I need help kasi we need energy as well And ngayon, natuwa ako.
Here are 4 people who are willing to help you, Doc. And finally, Ben. Ben?
Yeah, okay. First of all, I'd like to thank Dr. Tony for the information of what's happening inside the IATF. I think my challenge for all of us is since we want to reopen the economy, we need the data so we can estimate the risks. Johns Hopkins School of Public Health, they already have a risk. If you go to the barbershop, what's the risk? Wala pa tayong ganun we need all those information, and I hope we can have that information in real time so we can make the decisions.
All right.
Local government, national government can make the decisions.
All right. So, Doc Tony, your parting words to especially to Bam and Alejandra. who are our future.
Alam nyo, very close to my heart ito eh. Kasi I have 3 kids. Lasal yung isa UST, sa Atenista. Pero lahat sila nag-iisip about their future. Now, why don't we have a Viber thread of your key opinion leaders and see what we can do? We can use and maximize our talents eh. Kung nasa bahay lang tayo. For a higher cause, bigger than ourselves eh. Just think about it, guys.
Yes.
5 to 10% of your time and your talent will be contributed dito sa ating cause. It will mean a lot for the country.
All right, so we'll make that Viber group, no?
Let's create that Viber group so that we can actually address all the problems. We have to connect to each other. Alam mo, nasasayahan ako sa pag-connect eh. At first time I talk to strangers. And my job as a physician is to talk to strangers and get their trust and their receptiveness also. And natutuwa ako sa exchanges natin. I've never been happy in my conversation with people na I don't know. And I'm surprised as well.
All right. So thanks, Doc. We'll continue to pray for you. Our prayer warriors will pray for you, and we'll make that Viber group. So Ben will make that Viber group. So we'll see you, Doc. We'll see you.
And then we can have another katipunan periodically, this kind of conversation, and see where we are. Kunyari, where are we now? Where are we now? Where do we want to go? And how do we get there? So we can have periodic, radio. Kasi every 2 weeks, tingnan natin kung ano naging... kasi a goal without a timeline is a dream. Dapat may timeline tayo eh.
That's very true. So, I'll say goodbye now. For now, bye, Doc Tony, and for our panelists, and Bam and Alessandra. We'll see each other again next week.
Okay.
All right. Bye.
Thank you. Bye-bye.
Bye. Bye, everyone. See you.
Success.